Hi guys, it is Nicola here at Sports Rehab Academy, talking today about something that really should be your superpower, something that you should absolutely nail every time with your clients. So the past few weeks we've been doing a series of videos and we've titled them the 7 most common mistakes that we all make with new patients, and we've talked about lots of different things. But I get so many therapists who will contact me and be asking me, what are the best ways to run a practice? What are the best ways to build up and get new patients? What should I do to my website? What should I do? Should I do Facebook ads? Should I do Google AdWords? And these questions are all great and they're all really valid. But some of the topics that we've been covering in the past few weeks really are absolute 101 basics. And that is communication with your patients is your superpower. If you're recently graduated or you're just starting to build up a practice, the number one way that you can get new patient referrals is from your existing patients referring you people. And if you don't make that connection, that powerful connection, and have your patient feel really, really heard, the chances of them referring you new business is drastically lower. So I'm going to run through and just summarize what we've been talking about in the past few weeks and some of the main points, because it's so important. This will absolutely help you grow your business. So we talked first of all about banning any anatomical language. We often forget when we've been through that course how much we have gained a whole new language, and remembering that your patient doesn't know what gastrocnemius is, your patient doesn't know what thoracolumbar junction means, your patient has no idea what these medical terms use, even medial or lateral, they don't know what these terms mean. So ban them, stop and think every time before you use those kind of phrases, and make sure that you're translating that so your clients know exactly what you're talking about when you're communicating your findings. They know exactly what you're talking about. We talked as well about listening, about putting your pen down, stopping typing on your computer and listening to what they're saying to you when you're taking a new patient intake form. Our clients, especially in the UK, they're so used to going to their GP, they're so used to having like a 3 or a 4 minute slot and to like blurt it all out and get it off their chest as quickly as possible. And when they see that you're listening, you're taking the time, they visibly relax and will really start to tell you their story. And all those questions that you've got running around in your head that you're trying to remember the order and which question to ask next, they'll answer half of them if you just let them tell their story, okay? We also talked about making sure that they're with you, asking for feedback. So if you've just gone ahead and explained what's going on and said, right, this is our plan going forward, and you say, how does that sound to you? Have you got any questions? And they say, yeah, so what actually is causing it, or what's going on? You've missed them, you've lost them somewhere along there. You might have used anatomical words, somewhere you've lost them. So do check in with them periodically through the consult and make sure that they're still with you. Make sure that you're identifying why they are here. So what has caused them to suddenly take action at the moment? And we talked about this last video and we got some really good comments about it, about, what brings you here at this particular point, or why is it important to address this now? And often you'll really get to the crux of the matter as to why they're in front of you at that particular time. It could be that they've got a half marathon in 6 weeks, and the half marathon is going to be there to raise funds for charity, and it's a cancer charity, and the granddad died of cancer last year. Suddenly the stakes are very different. Suddenly you understand what's going on, and suddenly you're able to help them reach that goal, to communicate with them in a very different way. So if you're saying to somebody, I want you to do this hamstring strengthening exercise because it's going to help get your knee better, is very different to say, right, I'm going to give you an exercise that's going to strengthen up that knee. It's going to enable you to get back to training, get back to running, get that sponsorship money in for that cancer charity for you, get you to run that marathon. It's a very different way of communicating and much more effective. and making sure that you're really listening to your clients. We also talked about this with an example of a patient that I had that came in that said her back felt much better, but it still felt really weak, and how you have an opportunity there, again, to really make your client feel really heard. So addressing the fact that if somebody says it feels weak and they've got anxiety there because their back was so bad and the pain is gone, so they're starting to feel really hopeful, but it still feels weak, they're worried that at any time it could reoccur, addressing that, making sure they feel heard. All of these things, making sure that communication within your practice absolutely becomes your superpower, that you really are taking time to engage with your clients to make them feel heard. All right, guys, that's my rant over for today. If you have missed any of those videos, then do visit Anatomy Corner, our video blog at Sports Rehab Academy. So we've had 7 different videos in the last few weeks, just all talking about and focusing on communication with your clients and how to make sure that you're doing the absolute best you can with that before you think about changing your website or doing any of these sexy marketing things. You've got to make sure that what you're actually doing one-to-one with your patients is amazing, and that will get you lots of word of mouth referrals and just so increase the effectiveness of your work with your clients. All right, guys, I hope that finds you well, and if you do have any questions about anything you've seen in this video or on any of the previous video series, then please do put a comment in the box below. Take care, I'll see you next time. Bye bye now.